So good day, dear doctors, and welcome to this internal medicine blitz on infectious diseases. So for this module, we will be summarizing the must-know pearls from chapter 189, which is entitled Epstein Barr virus infections, including infectious mononucleosis. So let's start the ball rolling, and let's take note of the pertinent concepts that you should be bringing with you to any standard exam, as well as your clinical practice. So Epstein Barr virus is the cause of heterophyll positive infectious mononucleosis. Okay, so EBV is the cause of heterophyll positive infectious mononucleosis. Now question, what is the most common cause of heterophyll negative infectious mononucleosis? Heterophyll negative. Okay, very good. It's CMV or cytomegalovirus. Now, the classic infectious mononucleosis or IM manifestations caused by Epstein-Barr is going to be the following. Do not take the boards if you do not know this. Fever, sore throat, lymphadenopathy, and the atypical lymphocytosis. Now, friendly reminder for your exam, it is atypical lymphocytosis, okay? Sore throat usually presents with pharyngitis, similar to streptococcal pharyngitis, with or without the presence of exudates, okay? Now, these are the Epstein-Barr virus associated tumors. Most pathology books, most microbiology books only mention 3 tumors. Take note, Harrison's mentions more. Nasopharyngeal CA, gastric CA, Burkitt's lymphoma, Hodgkin's and T-cell, as well as B-cell lymphoma and smooth muscle tumors. It is the last 4 which are usually seen in severely immunocompromised, particularly those with HIV or AIDS. So please take note of that. Now, tip, you don't have to memorize everything, but memorize nasopharyngeal CA, memorize Burkitt's, memorize Hodgkin's, okay? Memorize nasopharyngeal, memorize Burkitt's lymphoma, and memorize Hodgkin's disease. Again, please take note of that. Now, question, which of these tumors would present with the Reed-Sternberg cell? Which of these tumors would present with the Reed-Sternberg cells? Okay, very good. The RS or the Reed-Sternberg cells, the owl's eye, the mirror halves, this is seen in Hodgkin's lymphoma. Question, which of these tumors would most likely be located in the fossa of Rosenmuller? Which of these tumors would most likely be found or located in the fossa of Rosenmuller? Okay, it's nasopharyngeal CA. Most common location of the nasopharyngeal CA is the fossa of Rosenmuller. So please take note of that. Now, which of the following tumors in front of you would present with a lymph node biopsy, okay, a lymph node biopsy that has the starry sky appearance? Starry sky appearance. Very good. Burkitt's is the starry sky appearance. Now, question, what is the oncogene which is usually associated with Burkitt's lymphoma? Okay, what is the oncogene which is associated? Very good. It's the C. mic or the C. mice. Okay, C. mic or the C. mice. That's associated with Burkitt's lymphoma. Okay, very good. You have been taught well. Now, for the epidemiology, classically Epstein Barr virus occurs during early childhood, and it's going to peak again during late adolescence. Now, I think this is the most important thing to bring in this slide. It's oral secretions, and it's usually transferred during kissing. This is why, what's the other name of Epstein-Barr virus? What disease does it cause? Okay, this is known as Kissing's disease. Okay, now for adults, you have to remember this is associated with blood transfusion as well as those who underwent bone marrow transplant. Now, question, what if the patient underwent a kidney or a heart transplant? What virus would most likely cause a post-transplant infection? Kidney or heart transplant. Okay, very good. This now becomes cytomegalovirus. Okay, now this is very important. More than 90% of asymptomatic individuals would shed the virus in their oropharyngeal secretions. And remember, this Epstein-Barr virus is transmitted through intimate kissing. Okay? If there are symptoms, then it's going to present with the classic fever, the lymphadenopathy, and the tonsillitis or the pharyngitis. Now, for the pathogenesis, Epstein-Barr virus is transmitted by salivary secretions. The virus would infect the oropharynx as well as the salivary glands, and it is from the salivary glands where the virus will be shed. That's why it's through kissing, the transmission. Now, it is also stated in the book that the tonsillar crypts are involved, particularly the B cells, as well as the lymphocytes. From the tonsillar crypts, it's going to travel through the bloodstream. It's going to target and proliferate in the beta cells as well as the lymphoid tissue. So there's going to be proliferation in the beta cells, or the B cells rather, and there's going to be enlargement of the lymphoid tissues. So what did you notice about EBV? What cells does EBV love? What cells does EBV love? Very good. It loves the B cells. Is that clear? Okay, it loves the B cells. Okay, now, signs and symptoms. Incubation is about 4 to 6 weeks. Now, I want everyone to remember, most common during the first 2 weeks is low-grade fever. Most prominent physical exam is the lymphadenopathy and the pharyngitis. Once there is splenomegaly or splenic involvement of the reticuloendothelial system, then there's going to be splenomegaly. There's also lymphadenopathy, which favors the posterior cervical nodes. And the most prominent sign, memorize this for your exam, is going to be the pharyngitis. There's a rash, which is more biliform or papular. It can occur on the trunk or the arms. Now, doc, there's so many things to memorize. Memorize this. Okay, the most prominent sign is pharyngitis. This is very important because in children, if there's significant tonsillar enlargement, this can lead to upper airway obstruction. Okay. Now, question, what childhood illness presents with fever and posterior cervical lymphadenopathy. And it also presents with a rash. What childhood illness presents with fever? There's posterior cervical lymphadenopathy, and there is a rash. Very good. Two things. Think of rubella, okay, think of measles, and if there's significant mucocutaneous involvement plus conjunctivitis, you think Kawasaki. Okay, now always remember, if you are with me and I am your mentor, it is not about simply memorizing what's in the book or what's in the handouts. If you are with me, we throw away the handouts and we rely on the book. And to give you that CDB edge, you need to comprehend, you need to analyze. You have to think out of the box, you have to think differentials, you have to comprehend. And that is why when you take the actual exam and hopefully go into training and your future practice, you think in algorithms in your head, okay? And the only way to do that is to think out of the box, okay? Now, here's the infectious mononucleosis rash, okay, morbilliform rash. Then we have the laboratory findings, okay? Keyword to memorize from the book is the atypical lymphocytes. Do not take the boards if you do not know that, okay? And always remember, among the atypical lymphocytes, what will predominate is the CD8 T cells. Liver function test is usually abnormal. A liver function test in more than 90% of cases is going to be abnormal. It ranges from elevated bilirubin to elevated liver transaminases, as well as alkaline phosphatase. Just tell yourself, the liver function test is abnormal. Then you have the lymphocytosis, and you have to put the word atypical, okay? Atypical lymphocytosis. If the exam is 2 minutes from now, pharyngitis plus atypical lymphocytes, what infection should pop into your head? Infection, huh? Not organism. I just simply mentioned the keyword of pharyngitis and atypical lymphocytes. What disease should pop into your head? What disease should pop into your head if you hear pharyngitis plus atypical lymphocytes? Very good. You should think of infectious mononucleosis. And if I tell you it's heterophyll positive, what virus pops into your head? If it's heterophyll positive, it should be Ebstein Barr. What if it's infectious mononucleosis, but it's heterophyll negative? Then you start thinking CMV, okay? This is how I want you to think, okay? That is why, personally, okay? Now, the Monospot Test, okay? This is to detect the heterophyll antibodies. Now, in your textbook, the Monospot Test is also known as the Paul-Bunnell test because it's detecting the Paul-Bunnell antibodies, which refers to the heterophyll antibodies. Now, I just want to mention this in your textbook. Yan, ito yung picture sa Harrison's. Okay, we have enlarged lymphocytes with abundant cytoplasm as well as vacuoles. That is what is meant by atypical lymphocytes. Okay, enlarged lymphocytes with abundant cytoplasm. Okay, now I want you guys to always remember Robert Downey. And what famous role does Robert Downey portray in the movies? His most famous. What is his legacy? Okay, Robert Downey is Iron Man. The initials of Iron Man is IM. So what disease presents with the Downey type 2 cells? What disease presents with the Downey type 2 cells? So just think of Downey, Robert Downey, I am Iron Man, I am infectious mononucleosis. Those atypical lymphocytes, that is the Downey type 2 cells. Okay, now always remember, always remember, IM stands for Iron Man. Is that clear? So this is the atypical lymphocytes. Okay, so since Robert Downey died in the movies, I'm preparing for my debut, okay, in Hollywood. Now, tip. Based on this table on the signs and symptoms of infectious mononucleosis, what is the most important symptom? What is the most common symptom? Learn how to dissect the tables in the mother textbook. What is the most common symptom? It is sore throat. Diba? The term sore throat is the symptom. Okay, look at this. Next, what is the most common sign? What is the most common sign? Okay, very good. It's lymphadenopathy. Okay, followed by fever and pharyngitis or tonsillitis. Now, tip, memorize these three. Okay, memorize these three. Okay, so we're winding down. For the complications, majority of infectious mononucleosis is self-limited. Death is very rare. If death does occur, Harrison's clearly enumerates the following situations. 1, if there's CNS complications. 2, if there's splenic rupture. If there's upper airway obstruction from enlarged tonsils, which is more common in children, and if there's bacterial superinfection. Okay, please take note of that. Now, the one that came out in the boards was a case of splenic rupture. Nag-tonsillitis daw yung pasyente, then died of splenic rupture. This is classic infectious mononucleosis. Now, winding down, as for the complications, if it is a central nervous complication, ito yung usual cause of death. The most common neurologic abnormalities is meningitis and encephalitis. So if there's a history of pharyngitis and lymphadenopathy and biglag ng meningitis and encephalitis, always think of Epstein Barr virus first. Okay, now winding down. Question: what is a recessive disorder of young boys who develop a fatal lymphoproliferative disorder after an Epstein Barr virus infection? Very important in the pathogenesis of this lymphoproliferative disorder is what we call the SAP. Okay, so there is going to be death from this rare disorder. This is what Harrison's calls X-linked lymphoproliferative disease. Okay, X-linked lymphoproliferative disease. So this is fatal, fatal, X. You are now crashed out. Okay, and this is after Epstein Barr infection. So please take note of this. Now here, This is mentioned at the end of the chapter. Oral hairy leukoplakia. Oral hairy leukoplakia. This is an early manifestation of HIV. These plaques, which you see along the tongue, this contains Epstein Barr virus DNA. Okay, oral hairy leukoplakia. So please memorize this. So once you hear oral hairy leukoplakia, think of HIV, and always think of the virus, Epstein Barr virus. Okay, EBV. And take note of the test, huh? This is the heterophylltess, which is used for the diagnosis of infectious mononucleosis, okay, both in children and in adults. So it's about, in your micro books, it only mentions agglutination of sheep's RBC. In Harrison's, it goes beyond that. So it involves agglutination of either sheep, horse, or cow erythrocyte. Okay, so please take note of that. So lastly, we have here the differential diagnosis of infectious mononucleosis. Now, we have here, very important, Epstein Barr, CMV, HIV, toxoplasmosis, HHV6, streptococcal pharyngitis, rubella, lymphoma, and even drugs. Now, always remember, all of these will present with fever. Almost all will present with lymphadenopathy. Almost all, except for the drugs and the viral hepatitis, will not present with a sore throat. The others can also present with atypical lymphocytes, but it is the more than 10% atypical lymphocytes, which is the clincher. Okay. So I want you to take time, especially those who are taking the PSBIM. Go over this table about the differential diagnosis of infectious mononucleosis. Okay. So this ends the chapter. So this ends the chapter on infectious